Echocardiography in aortic regurgitation. In today's class, we will be discussing about transthoracic echocardiography in aortic regurgitation. Echo assessment include establishing a diagnosis, determining an etiology, evaluating the effects of volume overload on the left ventricle, and careful assessment of the aortic root. So when you go into detail, etiology means we have to find out there are many congenital causes as well as acquired causes for aortic regurgitation. Most common congenital cause is a bicuspid aortic valve and acquired cause is hypertension. So when you see the short axis view of the aortic valve, you will be able to make out the how is the cusp arranged, or is there any associated lesions, other valves are involved in rheumatic heart disease, or if there are any root dilatation which can be seen in hypertension as well as in cystic median necrosis, also in Marfan's. So that echo assessment helps in determining an etiology. And the importance of volume overload is that if there is an acute AR, it will result in an acute overload, volume overload situation in the LV. While if it is a chronic AR, there will be LV dilatation and the LV will be able to withhold or withstand the increased end diastolic volume overload, and also the careful assessment of the aortic root. So this is the parasternal long axis view, and on the right hand side of the slide we can see that the normal structure seen in the parasternal long axis view. So when you see the parasternal long axis view in this patient with aortic regurgitation, we can see this is the right ventricular outflow tract, this is the LV which is seen hugely dilated in this case, and this is the aortic root. In this we can see that aortic root is occupying only one third or less than 1/3, but here it is, we can see that more than half of the screen is occupied by the aortic root, and because of that we are not able to see the left atrium in this. And this is the anterior mitral leaflet, and this is the posterior mitral leaflet which is seen in this. And when you put the color wave Doppler across it, we can see that there is a turbulent flow across the mitral aortic valve, and we have to time it with the ECG recording. So when you see the ECG recording, we can make we should understand that from the beginning of the QRS to the end of the T wave is a systole, and from the end of T wave to the beginning of the QRS is diastole. So during diastole, we can appreciate that a flow is happening across the aortic valve during diastole. So see, so this is actually diastolic flow occurring across the aortic valve. That indicates aortic regurgitation. So when you put M mode across the mitral valve, we will see this is the first picture is showing the normal M mode which shows DEF AC waveform, and if there is associated aortic regurgitation, the regurgitant jet from the aortic valve will reach and hit across the anterior leaflet of the mitral valve, and it will cause a fibrillary pattern in the anterior mitral leaflet. And that's why here we are seeing the regurgitant jet causing vibration of the anterior leaflet of the mitral valve. So when you measure the aortic root, so in the right hand side we are seeing the normal dimensions which is showing aortic annulus 20 to 31 mm in a closed aortic valve when the aortic valve leaflets are closed. Sinus of valsalva about 29 to 45 mm, sinotubular junction 22 to 36 mm, tubular ascending aorta 22 to 36 mm. And here we can say that at the level of the sinotubular junction, it is almost up to 65 mm. Here it is 6.5 cm, about 65 mm, which indicates that the aortic root is definitely dilated. So this is the apical 5-chamber view. On the right side, we see the normal apical 5-chamber view, LA, mitral valve, LV, aorta, then RA, tricuspid valve, and the RV. So here in this, on the left hand side, when you see here, we can make out only the LA and LV and the aorta. This part is aorta. We cannot make out RV and tricuspid valve and RA because because of that hugely dilated LV, it is occupying almost the whole of the field in this. And when you put the color Doppler across the aortic valve, so this jet which is this turbulence or a mixture of color we are seeing is a regurgitant jet. We have to time it with the ECG and see, and we can see that the regurgitant jet is going beyond the, and this is anterior mitral leaflet, so it is going beyond the anterior mitral leaflet and almost touching the posterior wall of the left ventricle, and that indicates a severe aortic regurgitation. So this is the parasternal short axis view at the level of the mitral valve. On the right hand side, we see the normal parasternal short axis view. This is the anterior leaflet of the mitral valve, and this is the posterior mitral leaflet, and this is the interventricular septum. And in this patient, we can see that the LV is dilated, and there is spontaneous echo contrast inside the LV cavity. And when you put the color Doppler, we can see that there is a turbulent jet which is almost hitting against the anterior mitral leaflet. And we can, when you time it with the ECG, we can make out that this is occurring during diastole. This turbulence is seen during diastole. So this is the parasternal short axis view at the level of the aortic valve. Right hand side, it is a normal parasternal short axis view which is showing the tricuspid aortic valve. While on the left hand side, when you see that because of the aortic root dilatation, it is occupying more than 2/3 of the more than half of the screen, and we can see that there is we can appreciate properly only, we can appreciate here only two cusps, that is one cusp here and one cusp here. We cannot appreciate the third cusp here, and in between the cusp we can see the regurgitant jet, turbulent color. There is a mixture of colors which is the turbulent regurgitant jet occurring across the mitral aortic valve can be appreciated in this, and we have to always time it with the ECG. So when you put the color continuous wave Doppler in aortic regurgitation, we will get a waveform, and the length of the waveform will indicate the intensity of the aortic regurgitation. If you get a longer waveform, it indicates a low intensity aortic regurgitation, that is a mild to mild, and if it is a short intensity waveform is obtained, that indicates moderate to severe aortic regurgitation. That means the pressure half time is less. That is, the time required for the pressure to become half is less, means there is a large regurgitant jet and a severe aortic regurgitation is occurring. So based on the pressure half time only, we classify aortic regurgitation into mild, moderate and severe. So in this patient, we can appreciate that the pressure half time is about 264, which will come under the moderate aortic regurgitation. So as the severity of the aortic regurgitation increases, there will be diastolic flow reversal in descending thoracic aorta, which can be appreciated with the there is a reverse waveform which we see here in this part, that is mild early diastolic flow reversal, and that indicates a severe aortic regurgitation. And venae contractae across the aortic valve is measured to measure the severity of aortic regurgitation, and based on that, mild less than 3 mm, moderate 3 to 6 mm, and severe aortic regurgitation is more than 6 mm. This is how we assess aortic regurgitation using transthoracic echocardiography. It is in a superficial discussion for beginners. Thank you.
Over the chest, chest, the forehead and the axilla, that is elbow. Caesar. Okay.